Welcome to e-luminate, formerly known as Sounding Board. e-luminate is a production of Seroptimist International of Novato. We will be talking to doctors from the Marin Community Clinics, the largest provider of comprehensive health care to low-income residents of Marin County, one of the most affluent communities in the nation. We'll be talking about behavioral or mental health with Dr. Elizabeth Horowitz, Director of Behavioral Health, and Dr. Mitesh Popat, Chief Executive Officer of Marin Community Clinics. Thank you both for being here with us.
Thank you for having us.
I'd like you to start perhaps by defining what you do.
Sure. At Marin Community Clinics, we serve 34,000 of the most vulnerable people in Marin County, and we provide comprehensive services, medical care, dental care, and behavioral health services, which is what we're going to be talking about today, as I understand. We pride ourselves on high quality care and taking care of the whole person, reducing disparities in care where there are differences based on income or ethnicity or any other factor that one can think of. So that's our role at Marin Community Clinics.
And what is behavioral health?
It's such a great question because there's a distinction we draw between mental health and behavioral health. So behavioral health is a comprehensive term. It encompasses mental health as well as addiction or substance use or abuse. And so we address all of those issues in our behavioral health program.
What are some mental health concerns that keep people from coming to you? Why do people not come to the clinic?
You know, there's so much stigma about mental health, about behavioral health, right? Addiction too has a lot of stigma. And so one of the reasons that at Marin Community Clinics we have integrated behavioral health, which means we're not just co-located where people go to get their medical care, but we actually work as a team with the medical providers. We're there to help reduce stigma. So before integration, people who were suffering from mental health issues or behavioral health issues would have to go find a therapist or treatment center on their own, or they would go to their doctor and say, I'm struggling, and the doctor would just have to say, I think there's something down the street for you. By being there on site in the moment, people no longer have that barrier. Most people go to the doctor at first for mental health concerns, and so because that's a relationship that they trust, there's less stigma about going to the doctor. So at MCC, what happens if someone goes to their doctor and says, I'm feeling really crummy, what the doctor will say is, you've come to the right place, and I have someone that can talk to you.
And a lot of times physical mental health conditions, behavioral health conditions present themselves physically, and someone may not realize they are having a behavioral health issue really, and as Lizzie said, as opposed to kind of giving somebody a cold transfer to a behavioral health professional, by having somebody on site working together as a team, you can kind of make sure that person who's in need, who has now an identified behavioral health issue, kind of gets pulled directly into care and to appropriate treatment for them. Aside
from some of the things you've mentioned already that people need help with, what about suicide? Is that something you can deal with?
It's such an important and timely question. Right now, we know that suicide is actually the leading cause of preventable death among adults in the United States. It's actually on the rise. And so increasingly, we're seeing primary care as a place to screen for and prevent suicide. So that's something that we take very seriously. All of our patients at MCC get regular screenings for depression, which includes a question about thinking about suicide. Thinking about suicide is actually pretty common. And so what happens when we ask those questions in a way that's systematic is that we don't miss people. And so someone answering those questions, if they are thinking about suicide, we have a whole protocol for what we do and how we talk to those patients and the services that we connect them with that moment. But it's not just that. Another protocol that we have at MCC is anyone who's made an attempt or had any kind of suicidal gesture, we actually follow them very closely. We reach out to them. We're very proactive because we recognize that suicide it's a public health concern, and it's serious and it's real. And all too often, people are afraid to ask about it, right? Historically, it was like, if I ask about it, maybe I'll put the idea in someone's head, right? And we know that's not true. And in fact, people who are really suffering, what they want is for when they go to their doctor, for their doctor to ask.
Wow. Would you say it's something similar with depression, that people are afraid to ask or admit that they need help? And what do you do? You said that the primary doctor might discover it. Mm-hmm. Can they just come to you, though?
Can they just come to behavioral health?
Yes.
Well, I'll back up and say, talking about depression, yeah, there is a lot of stigma. So one of the reasons we ask about it in primary care is to try and reduce some of that stigma, to say, we're going to ask you about your mood, just like we're going to weigh you, just like we're going to check your blood sugars, because mental health and physical health, that's all part of health. Mm-hmm. Right? And so it's really shifting the paradigm for patients about, we're going to ask you about your emotions, we're going to ask you about your physical health, we're going to ask you about home life and the social determinants. And that's something that Dr. Popat was talking a lot about, is there's a lot of disparities in our population. So we understand how, not having a stable place to live not only affects physical health, but emotional health. And so we try and address all of that in the clinic.
And we've done things like adding groups for stress management mm-hmm. and depression and these sorts of things to try to provide different formats for different people. Some people like to receive care one-on-one, and we offer that. And other people really enjoy having a group of peers who are dealing with similar set of issues, and coming up with similar their own solutions, and having a forum to share those experiences is often appreciated and valued. And everything from mindfulness to meditation to yoga to different modalities, different techniques, different approaches that we offer, because we realize one size does not fit mm-hmm. all with these sorts of issues. And one person might be open to acupuncture, and another one might be open to one-on-one sessions with a mm-hmm. behavioral health therapist. And so the ability to offer a range of approaches is something that we really value, because it's really important to be able to customize a care plan for someone.
That's very interesting. I didn't expect to hear that. There is a whole range of options. That's all at Marin Community Clinics. That's mm-hmm. wonderful.
Yes.
Including medication management as well. So a lot of times when we pick up on a behavioral health concern, we'll say, there's many options available, and as Dr. Popat says, not all the options are right for everyone. It sort of depends on circumstance, on individual preference. Some people don't have time to come in for therapy, or they say, I'm doing everything. I have a therapist, or I talk to my spouse, and I'm running every day. I'm doing everything right. I just in a bit of a funk. And so then maybe medication is an appropriate approach. So our primary care providers are all trained in psychopharmacology, but we also have on-site psychiatry who provide consultation and brief medication management services.
Wow, that's important.
It is.
Very. Thank you for bringing those things up. Is there anything else you'd like to share with us about your department?
Well, one area that's interesting, I think, that we're embarking on now is really focusing more on prevention mm-hmm. and looking at the next generation of folks who are suffering early childhood traumas and the impact that has on a lifetime. And that can be a wide range of traumas that I'm sure Lizzie, Dr. Horowitz here can elaborate on, but it's basically the idea is that traumas that happen in childhood impact one's health and well-being for a lifetime. And not only that, the people who suffered traumas who are adults now need maybe a different approach in how we engage with them, how we approach them, how we treat them, so that we can get the optimal result and take as good care as we can of them. So we're really changing the way we're thinking about providing care to people, and also thinking at preventing sort of the next generation from having the medical issues, which have been shown to be really associated with trauma, and also the behavioral health issues that result from that as well.
One of the ways we like to think about it, and this is sort of true of what we call trauma-informed care in general, it's a shift from asking what's wrong with you to asking what happened to you. Because what we find are our adult patients that have, a lot of different chronic illnesses, and maybe they're smoking and struggling with, being overweight. When we really look at their histories, these folks tend to have a pretty traumatic history in their childhood. And so how do we understand that and bring that into the room? How do we address that in the treatment plan? So that's one piece of it. And as Dr. Popat said, now we're also focusing on prevention. So working with small children in the newborn visit, even back to the, we also offer obstetric services. So during pregnancy, screening the women that come through our doors to say what's going on at home that might ultimately turn into a trauma, and how can we wrap around you to prevent that. And that's a really big change for primary care, and we're really excited that we're able to offer that.
I'm so glad you talked about that. That's wonderful, really noble. Yeah, thank you. Thank you both for being with us and talking about it.
Thanks.
Thank you.
Thank you all for watching.